My name is Ivy Norris Sumner. It is an honor to have the opportunity to speak with you today about an exciting new community-centered program entitled Produce at Home to Progress. Primarily, it would be valuable to offer a broadly encompassing overview of some of the areas of foremost concern within the discipline of public health in the contemporary society. Upon deliberation of the Healthy People 2020 categorized topics, health insurance, holistic physical health, environmental health, mental health, and the social determinants of health are distinguished as high priorities. After a period of strategic analysis of these core facets, the idea of physical health reverberated as vitally relevant. Through a process of narrowing the focus, the issue of chronic obesity came to light as necessitating further tailored interventions. It is especially integral to recall the interconnected nature of physical health with the other listed areas, as a multidisciplinary approach has demonstrated great remedial success. In displaying the urgency and obligation of public health departments to address the foreboding nature of obesity, I would like to provide you with a contextual snapshot of recently published data. Firstly, it would be useful to assert that this condition is preventable and cannot be transmitted from person to person, as is so commonly the circumstance in the domain of epidemiology. As a result, the approach to treatment may appear dissimilarly to a traditional corporeal illness, though this does not diminish the significance of the concern. Therefore, in order to provide a historical frame, it has been calculated that obesity has tripled since 1975 worldwide. Consequently, there are approximately 1.9 billion, or 39%, of adults in which are over their physiological ideal weight. Out of this number, 650 million adults around the globe meet the body mass index range to be considered obese. Though this specific initiative may naturally lend itself to assisting adult populations with weight loss, it is of equivalent importance to ponder that there are 379 million children that are also severely overweight. Reviewing the displayed chart, the trend is noticeably growing. Although the economic considerations do not carry the same weight as those regarding physical well-being, it is noteworthy to transiently mention that on average, the annual medical costs of those diagnosed with obesity were elevated by $1,429 when compared to those without the condition. Another point in which enhances the magnitude of the issue at hand is the lack of geographic specificity, as obesity is not confined to one location, but rather is occurring at rapid rates in a multitude of diverse countries. The predominant health manifestations in which have been evidentially shown to be associated with increased weights are heart disease, cancer, diabetes, arthritis, and strokes. Due to the shift in obesity prevalence rates over the prior 3 decades, the United States Health and Human Services has included a leading indicator on the Healthy People 2020 campaign entitled Nutrition, Physical Activity, and Obesity. The mission of this indicator seeks to improve the equity in food and exercise equipment access and attempts to prevent and manage chronic diseases. Amongst the first steps of this program's creation, an inductive health assessment was conducted in which provided an image of the macro to the micro echelons of obesity. Thus, nationally, the rate was notated at 31.9%, which is slightly below a number of states. For this specific effort, the state of North Carolina was assessed, which was found to be situated at 34%. Lastly, the local county of focus is Randolph County, which is a large central region in North Carolina in which the value was set as 32%. The demographic consideration in which stood out as most impactful for this county was the notion of the majority of residents, approximately 60%, being located rurally. After this, an informal community needs assessment was completed through research, in which it was discovered that this county has many areas that experience food deserts, where residents have little to no access to fresh food products. In addition to this, segments of the population were found to experience other disparities, such as poverty, language differences, or physical disabilities. After a data-driven examination of the various towns in Randolph County, it was concluded that rural residents having addresses in the towns of Seagrove, Staley, and Liberty will be served through this program. In further considering the segmentation of the targeted audience, it would be valuable to point out various subpopulations in which may potentially benefit from the intervention. Primarily, there is a relatively large amount of people within the lower and higher ends of the age spectrum, as 18.1% are above the age of 65 and 22.2% are under the age of 18. Another demographic attribute is that 14.1% of the population are at or below the threshold for poverty, which is significant to reflect on when considering the true needs of the population. Next, another factor to integrate into the construction of the program pertains to those in which identify English as their second language, as it would be more equitable to offer bilingual resources. In the same way, 11.9% of the Randolph County population have reported living with some form of a physical disability. So, upon rumination of the totality of the research, it is with great pleasure I propose to you the installment of a mobile farmers market system. The aspiration is to serve residents in the 3 predefined towns through the regular delivery of locally grown fresh fruits and vegetables. Through collaborative partnerships with farmers, food banks, and other health organizations, the accessibility of nutritious foods could be enhanced. In supplementation and to foster long-term knowledge and personal growth, the integration of a concurrent educational component is propositioned. Moreover, the underlying motivational framework to guide the effort could be described through the mission statement, in which offers the aspiration of this initiative is to combat obesity through increasing the availability of affordable, fresh produce to residents residing in the rural cities of Seagrove, Staley, and Liberty within Randolph County, North Carolina. Through enrollment in the program, the prospective benefits could be described as an increased reliance on small-scale farming, an increase in the types of foods within the area, an overall sentiment of health awareness in the community, reduced incidences of associated physical diseases over time, and an upswing in the perceptions and confidence one has in themselves from a dedication to personal health achievement. The leading goal of the program aspires to decrease obesity in Randolph County through the circulation of a mobile farmers market. The comprehensive list of objectives depicted in this visual offer insight into the desired areas of improvement, a suggested completion time, and a form of reliable measurement. The objectives highlight the inception of the process through the evaluative phase. The principal essence of these objectives is centered around the logistics of the actual delivery process, increasing community engagement, and establishing a voice to share weekly educational tools with all of the public. With each of the 5 aforementioned objectives, a customized intervention has been identified in which serves as a roadmap to guide the public health team through a series of manageable steps. As the verbs in the representation of vowels, interventions emphasize actions, as these truly provide the pathway for bringing the program to life. In addition to the implementation of a novel farmers market system, the secondary purpose of the initiative seeks to enhance the primary prevention of obesity resources available in Randolph County. Through perceiving of the objectives, it is hopeful the desire to spark a wide-scale cultural transformation within our local community is illuminated. The primary goal is aimed at the implementation of direct-level services of increasing helpful food attention, whereas this goal is aimed at the infrastructural realm to effect long-term awareness through the empowerment of local store owners and mobilization of community-based organizations. In the same vein as the first goal, the shown interventions provide a step-by-step guide for how to achieve each objective, with the ultimate goal in mind of increasing the resources available for the primary prevention of obesity development. In cogitation of the resources in which are required to carry out the interventions of each objective, the provided matrix categorizes the items as personnel, instructional, financial, or equipment-based. Firstly, the suggested personnel is the public health educator, volunteer drivers, farmers, staff from other agencies, a public health specialist team, and marketing experts. Next, when considering the tools that will help to share educational lessons with the community, classroom spaces, blank paper, training and course materials, video platforms, and writing utensils will be needed. For the pecuniary necessities, it would be beneficial to consider any fees associated with the delivery vehicles, the printing and lamination cost, software purchases and licensing fees, and exercise equipment. For the equipment, in-depth GPS navigation, monetary exchange instruments, statistical software, industrial quality printers, and a projection system for the classrooms are proposed. Due to variations in agencies, possible delays, and transitions in staffing, the specific dates of implementation demonstrated in this flowchart are subject to change. However, the three-pronged, phase-driven structure remains constant in any application or adoption of the program. The stages have been delineated as launch, growth, and evaluation, which serves the purpose of enabling stakeholders and team members alike to visualize the progress along the way, in order to inspire sustained effort for the overarching ideal of improving the quality of life for community members. In presentation of the theoretical underpinning embodying the Produce at Home to Progress program, the diffusion of innovation theory can be contemplated. The tenets of this theory strive to weigh the user-friendliness of the initiative with personal benefits to determine when the appropriate time for them to participate is. Theoretically, the momentum of the interventions over time seeks to engage all community members to create a permanent cultural change, but provides that there are varying classes of adopters, ranging from the innovators to the laggards. In application of this concept, it is hopeful that the mobile farmers market will continue to grow as time moves along, to eventually become a universally recognized, efficacious practice to reduce obesity and develop an appreciation for local agriculture. Now that you have an idea of the vision of the program, I would like to call you into action. I invite and encourage you to join me in the fight against the preventable condition of obesity in your community. If you have an interest in working directly with residents and are inspired to serve as a facilitator, you can reach out about joining a specialized task team. Similarly, you can get to know your community better through electing to participate as a delivery driver, product organizer, or help in conducting surveys and interviews. Amongst one of the primary factors that can help strengthen the magnitude of the market network is strong, trustworthy relationships with key partners. It would be wonderful to hear about any possible connections you may care to share. Although each and every contribution makes this effort possible, there is one activity I kindly request everyone do. Please tell others about the program. Thank you so much for your time, and I look forward to working together in the upcoming launch of PHP. The references in which the data was derived from.